Welcome to our breakout session addressing COVID-19 risk factors for long-term health. My name is Shiloh Jones, and I will be the moderator for today's session. On behalf of Business Group on Health, I first would like to thank the sponsors of today's session, Hello Heart and Newtopia. As you listen to the presentation and discussion, please submit your questions in the question box on your screen. Our speakers will answer as many questions as possible through the chat. You can also use the chat to share your reaction or feedback with the other attendees. So now I would like to introduce our speakers. First, we have Janet Lucas-Taylor, who is the Senior Director of Employee Benefits for Northwestern Mutual, where she leads employee benefit strategy and implementation. Prior to joining Northwestern Mutual, Janet served as an employee benefits consultant, servicing large national employers in the areas of healthcare, wellness, and employee engagement and experience. Next, we have Julie Wilkes, who is the North American Wellness Lead for Accenture, a global Fortune 500 company. As a heart disease survivor, Julie believes she was given a second chance at life for a reason. So thank you so much, Janet and Julie, for joining us today. I will first turn things over to Julie.
Thank you so much, Shiloh. It is such a privilege to be here to share a little bit of Accenture's journey with Newtopia with all of you. So if we can move on to the next slide, thank you. I want to start off by saying that Accenture has focused on well-being for a long time. I have been in the role that I sat in for about 15 years, of which I have overseen the North American well-being programs for about 50,000 employees and our partners and our families. And so we've always had this holistic approach to finding programs that inspire people, how they live, work, and play to be better. But what we have found over the past 5 or 7 years or so is that there are gaps in between holistic approaches to care. You see, as we're looking at this big picture, there are pockets that go underserved because we're looking to serve the general populations. And what we're really invested in now is to look at those pockets or those gaps in care where we really need to come in and find smart, integrated and sophisticated solutions that help us to bridge those gaps. And so Newtopia is one of those partners that we've made, in which we call it a data-driven approach to identifying those who are at risk and helping us to close our gaps in care. And so our focus is still on supporting the whole person, but we're looking to reach people who may in the past were people who put their hand down whenever we called out a wellness program, people who felt like maybe they had already taken themselves out of the opportunity, or maybe individuals in the past who thought that well-being wasn't for them or didn't pay attention to those programs. We really wanted to find ways where we could attract individuals on their terms in a way that felt authentic for them and inspired them to want to be more aware and take good care of themselves, both for themselves as well as for their family. So if we want to go on to the next slide. So we implemented Newtopia in January 2019 and had great success. Our employees were very interested in the program, and those who were eligible for it really wrote into us saying, this feels like something special. This feels like something different to us. And we really appreciated that. But as many of you did, as COVID-19 hit, we started to understand that the world was going to be changing in many different ways. And the popular word pivot came to market as we learned to pivot, just as you all did, to figure out how can we still continue to reach our employees both holistically in that general sense where we provide a well-oiled machine in terms of a solution for our employees, but also still found those gaps in care and brought those people along who may have not always been a part of the well-being programs. And so what we found as COVID hit is that most of our populations had been traveling or they had been going into client spaces. Accenture is a consulting firm, and our key goal is to help our clients to be more successful, which typically means we are with our clients face to face. That had to change. We had to reduce travel. We had to find new ways to reach our clients virtually, both internally and externally. But what we had to do is make sure that we could figure out how our people could show up at their best, because now we had to translate the language more so in a virtual atmosphere instead of face to face. And as you know as well as I do, that when you're virtual, sometimes there's not as great of an opportunity for you to feel that strong connection, or for you to really feel that ability for us to always stay connected and on the same page with things. And so it was really important to us that our people could take good care of themselves so that they could show up their best on screen with our clients and take care of them. And so we turned a greater focus on supporting our employees. We sat down, and I remember being in meetings in March, and boy, we didn't know what we were up for at that time, but we started to talk about how do we continue to help our employees? What are the things that they're going to need? What are the things that we're going to experience as individuals, as families, as colleagues, as teams, as populations, and as an organization? And as we continue to solve, new opportunities came along for us to continue to solve for, but here are some of the main things that we found. First and foremost, we know that as the whole world shifted and changed, everything we knew changed as well. From being able to go to a grocery store, being able to go to a gym, even sometimes being able to go outside, to having our kids try to find their way amongst school and homeschooling, and us sharing office space with our partners and our dogs and our cats and everything else. And we found that this was something that we knew we were going to have to take care of. So we really focused, number one, on making sure our people had the support they needed mentally to manage all of these changes going on. One of the things that as human beings that we crave is consistency, is certainty, is status, of being able to be aware of what's going on. And all of that sort of went out the door as COVID hit. And so as people felt uncertain, they felt uncomfortable, they felt unaware, and they started to feel as if they lost their sense of routine, their patterns that they were familiar with, and all the ways that they did work. There was a lot of information that told us that our people started to feel less successful, less healthy, less accomplished. They were less motivated. And so that is where we had the opportunity to shine for our employees. And I remember thinking back in April and May of 2020 that it is at the times that our employees are struggling the most that it is our responsibility to be at our best, because it is a time that we can really make a difference. And so we upgraded so many areas that we focused on for our employees, and the term our employees are our greatest asset really shone through, because we know that at Accenture, we don't create widgets, we don't create products, we offer a service. And that service is only going to be as good as the people delivering it. And so we decided to invest in our employees in new and different ways. We set up focus groups to learn firsthand what they were going through. We didn't assume what they were going through. We asked them to tell us, what do you need? We ended up upgrading our mental health resources. We ended up leveraging virtual counseling platforms so that everybody could have access to a counselor. We trained more and more mental health allies across the globe. These are employees who can be on the lookout to understand that if somebody is just not being themselves that day, that they have the right words that don't feel threatening and don't feel offensive and can help somebody to just get the support they need. These employees know the support services we have, and they're not meant to diagnose any condition, but meant to just be that friendly person on the other side of the video screen or the phone that can say, hey, I get it, and I'm here, and I can help connect you. We ended up focusing on childcare and backup childcare and improving those resources so that our employees had more options, more coverage, and more opportunities for them to feel as if maybe they could just take an exhale every once in a while and know that their kids were taken care of and that the schooling was taken care of. We developed meetups, online classes, activities, and ways to connect. One of my favorite ones is that we did a terrarium set, a garden where all of our employees got to get together and build their own terrarium online, or a topiary sort of garden. We also did paintings. We did all of these things. These are things that we had not done before virtually, even though we are a pretty virtual company. But we knew that human connection was absolutely essential for success. And so we ended up doing everything from yoga, Pilates, music, dance, painting, designing things. I even started to do different ways that you could make healthy juices, and we would do a happy mocktail hour where we would mix juices together. So we had a lot of fun doing our meetups, and I think that those will actually continue even after COVID. We also increased our availability for people to access teledoc. We knew that doctors were either going to be shut down or their focus needed to be on the COVID patients. And so we needed to have our employees have another route if they needed just daily care or support for a cold or something, asthma, that they could easily get from a teledoc physician. We wanted to make sure that was easier and more accessible, and we did that. And we also made sure that when employees were sick, they were able to take the time off that they needed. They didn't have to go through some lengthy application process. We made sure they could get out quickly so that they could take care of themselves, not worry, and return to work healthy and whole. In addition to that, we offered live daily workouts and live meditations, of which they've continued because our employees asked us to. Yes, we could play recordings of all those things, but they love that connectivity, that human connection of us getting together and doing something other than work and having fun together. We've done many, many fitness challenges through our workout apps, between gratitude challenges, kindness and happiness challenges, walking challenges, traveling the world challenges, where our activities allow us to travel the world together during a time that no one was able to travel. We virtually traveled. So we tried to have a lot of fun and do some creative things. And we also focused on habit change. We knew that everything was changing around us, and so people needed a little bit of structure. If they wanted to get back into the habits that they loved, we wanted to provide them a simple platform for them to set up their own habits, whether it was for weight loss. We did other types of nutrition habits, and we really did a lot of different areas of focus when it comes to setting goals and habits that stick. And so we had an amazing year, despite it being very tough and challenging. And we certainly aren't requesting to repeat it again, but we know that we took an opportunity where our employees were struggling, where the world was struggling. And we looked for opportunities for us to be there for them. And even if we just made their road a little bit lighter during this time, then we felt successful. So if you want to go on to the next slide, please. And so one of the things that we've known is that lifestyle habits can really dictate how successful we are in our overall health. Now, 30% of a person's predisposition to chronic disease comes from genetic factors. We know this to be true. But listen to this. These are fascinating data points. 40% come from lifestyle choices. 40% of our predisposition to chronic disease and illnesses come from the choices that we make every day. So you know what this means to me? This means to me that I have an opportunity in my role, you have an opportunity in your role, we have an opportunity as an organization to make that impact. We also know that 30% of that predisposition to chronic illnesses and diseases is due to social circumstances, environmental exposure, and healthcare, which is also something that as an organization we are responsible for, or we at least have a hand in helping with. So what this means to us is that we have this huge opportunity to potentially impact 50, 60, 70% of our employees' health simply by making it easy for them to make healthy choices, creating a culture and an environment that yields opportunity and meets people where they are as individuals and honors them as human beings. So if we want to go on to the next slide, please. We know that if you change your habits, you can change your future. If you're not doing something that you want to be doing right now, all we have to do is build a new pattern in the brain. All we have to do is build a new infrastructure that enables us to be able to reach our habits wherever we want them to be and change the outlook of our life, mentally, physically, emotionally, spiritually. And so our Newtopia journey begins here. As employees who are eligible for the program start off, they get an invitation. They get to build out their own personal profile. They get some genetic engagement throughout using the app. They have a personality matched inspirer who will help them to stay the course. So one of the things I really love about Newtopia is there's this huge data piece behind it, which I, as a individual who's focused on the why behind things, I need the data, and maybe you do too. So I love the fact that this is all data driven. But what they didn't leave out is the opportunity for our employees to be considered human beings who get inspired by others, who know that this is not this seamless, easy path one way, but that they're going to have twists and turns, and they need different tools along the way, such as their personality matched inspirer. They get personalized nutrition. They get a personalized exercise plan. It's not this scripted thing that hand off that 3 days a week, do this or that. It's based on what they've said they can do and what their goals are and how fast they want to go and what's realistic for them. An overall well-being plan. And so then as they go through the journey, they use the app constantly. And you know, apps are, I guess, at our fingertips, right? As we're in the back of a cab in everyday life outside of COVID, they were the things that we used to make our dinner reservations or to get us to the airport. But now they're even something that they just take one less step away from everything else we have to do in life, right? So we're so busy with our kids. We're so busy with trying to manage this new normal. We're so busy with trying to do everything that we need to do to take care of ourselves. This puts this at your fingertips. And our employees tell us they need it to be easy. We can't ask them to recreate the wheel. It has to be a part of their pattern of what they do and how they access things, and they don't have to go a million miles in order to do it. And so it's right there at their fingertips. They're able to use wearable biosensors, which is really cool. Our employees talk about the technology involved with Newtopia, and it's one of the things that distinguishes the program, makes it feel special, makes them feel as if it's something different. And that's what they really love about it, is it just feels different than anything they've ever seen. And of course, gaming is so popular because it feels more like something fun. I think we've become so serious in this world today, and for good reason. There's so much serious stuff going on. But how about just a little bit of fun and taking care of ourselves again? So it feels less like punishment, more like joy, reward, a gift to be able to take care of ourselves and to take care of our bodies and our minds and our hearts and our souls. And then, of course, there's this supportive online community that allows people to connect with other people and know that they're not alone in this. So I don't think it's any one part of Newtopia that has allowed our employees to be successful, but it is their holistic approach that allowed people to feel that it was something special, that they feel connected, that they get inspired, that they have the right information, that it feels personalized. And in a little while, I'll tell you about our results. But for now, this has been Accenture's journey through COVID. We've had this amazing opportunity to be there for our employees and meet them where they need us to meet them. And Newtopia has been one of our partners that we are privileged to be with. And so with that, I am very grateful to be able to partner today with Northwestern and my friend, Janet Lucas, who's going to be able to share, Taylor, who's going to be able to share with us a little bit more about Northwestern's journey. So, Janet, take it away.
Thanks, Julie. First, I'd like to share a brief introduction of Northwestern Mutual. If you could change to the next slide, please. We are headquartered here in Milwaukee, Wisconsin. We do have offices in New York and employees nationwide. We are part of financial services and the leading life insurance company in the United States. We have an average age of our employees of 43 and a pretty even population split from males and females. As is true for many companies, one of our largest areas of claim spend is in hypertension. When we first started to evaluate this in detail, we found that about $4.5 million of our claim spend was attributed to hypertension. We also looked at our health assessment and our biometric data to further identify risk factors within the population. Based on these two areas combined, we reviewed the market and selected Hello Heart for a pilot with our members in 2017. The response to the pilot was so overwhelming that we ended up with a wait list of members wanting to engage in the program, which really validated for us the desire of our members to have this type of support for themselves and their families. So we did a full rollout in 2018 with Hello Heart as our formal partner to help with hypertension and cardiovascular disease. Next slide, please. You know, when we think about the pandemic, it really has had a very considerable impact on heart health nationally. When we think about diagnostic testing, it's down significantly here in the United States. Looking at March of 2019 to April 2020, when the pandemic and the shutdowns really started to take full effect, angioplasties or imaging of the arteries, veins, and heart has been reduced by 55%, echoes by 76%, and stress tests are down here in the United States by 78%. Worldwide, this is also an issue with total diagnostic testing during the pandemic down 64% compared to pre-pandemic levels. As of today, these numbers haven't come up yet. And although they are starting to increase as Physician appointments are increasing and members are feeling a little more comfortable going out to have what maybe they think is elective procedures done. Many employers, including ourselves, have really seen a deferral of care by their members, which certainly is concerning if you don't have avenues for these individuals to monitor their health. Next slide, please. In addition to diagnostic testing being down, we've also seen an increase in risk and mortality during the pandemic. In the United States, about 45% of our adult population has hypertension. Pre-COVID, we've seen that about 75% of those were actually uncontrolled, clearly identifying a need for support for members pre-pandemic. But that's now risen to about 81% having uncontrolled hypertension. So really driving the need for increased support to those with hypertensive issues. Additionally, patients with hypertension do see a 60% higher risk for COVID complications. And we've seen 11% increase in mortality for hypertension in 2020. The data that we'll share from Northwestern Mutual really suggests that during COVID, our population that's engaged with Hello Heart utilized that tool, continued to monitor, continued to engage in education, and really tried to stay on top of their heart health, which significantly helped our population manage those risks. Next slide, please. So what's Hello Heart? Hello Heart was founded in 2013, and they've been on market since 2015 with a very simple mission: to empower people to understand and improve their health using smartphone technology. So as part of the program, each participant receives a Bluetooth-enabled blood pressure cuff that pairs with the Hello Heart app, which is on their phone, either Apple or Android, and uses real-time monitoring through and education through artificial intelligence. The technology is really super easy to use, and our participants talk about that all the time. I think there's some very unique advantages to how Hello Heart has designed their program delivery, which add convenience and help to all of our members. First, it is all electronic and available 24/7. So, two things related to this. One, it offers our employees flexibility. They don't need to find time in their day to schedule a call with a health coach or a disease management nurse. They can do this whenever they're feeling most comfortable and relaxed after they've put the kids to bed, and especially during COVID, where I think we've all felt a lot of pressure for time management within our households. The second is Hello Heart really focuses on very simple and small behavior and lifestyle changes that are aimed at lowering blood pressure. So if you're feeling stressed, maybe it's, pet your dog, take a short walk, how to change very small things in your diet or meal planning that impact your overall heart health. Thirdly, because the platform is based in artificial intelligence, the more a member or an individual uses the app, the more personalized the recommendations become. So the app can learn from your preferences and the things that you're responding to as you work through the program. The app is also fully integrated with the member's physician. So I think this is extremely important for our members, so they can select to have their readings sent directly to their physician. They don't have to remember to print or write something down or communicate when they're at an office visit. All of that is there for them, just taking that added step out and allowing the physician to really engage with the member on very regular basis and with very regular and accurate readings. And then lastly, I think most critically, if someone's not feeling well and they do take their blood pressure and they register as having a serious issue, the system will automatically alert that member and provide direction to them. So whether that's a case of you should call 911 or you should call your physician or a family member, it lets them know that and then walks them through that very oftentimes scary um, uh, piece and offers them the next steps that they need to make sure that they're safe and get through that episode. Next slide, please. And one more. Thank you. As I said earlier, we launched our pilot in 2017 and moved to a full program in 2018. Hello Heart is offered to all of our employees, their spouses, and domestic partners that are enrolled in our health plan. When we think about our results, the gold standard of looking at a digital hypertension program has two factors. First, it's the reduction of heart risk over time, and the second is focused on systolic blood pressure reduction. So over the last 3 years, we've seen a 54% of those that are enrolled in the Hello Heart program have reduced their heart risk, and very impressively, seeing a reduction of 19 points in the systolic BP for those at stage 2 hypertension. Stage 2 hypertension is those with a systolic blood pressure of 140 or higher. Lastly, we really have excellent engagements at Northwestern Mutual and with the Hello Heart program. We have 61% of those members enrolled have 39 meaningful visits on average, which is quite a lot of coming back to the app and actually engaging and logging and learning over time. So we're really happy that our members who engage stick with it and engage at this type of level. Next slide, please. Just to talk a little bit about program results, our users have seen really significant reductions in systolic blood pressure across all of these categories. So just to orient you to the slide, the red bars indicate week 1 of a participant's enrollment, and the green bars are the most current or recent outcomes. So as you can see across all categories, we have really pretty significant reductions. And just to provide some context, as you think about a 10-point reduction in systolic blood pressure reduces the likelihood of a serious heart event by 50%. So these results are extremely significant in terms of successful outcomes for our members being able to manage their health. Next slide, please. On this slide, we're seeing members in each year who are moving across the continuum of blood pressure categories. So you see the reductions in stage 1 and stage 2, and the increases of members who are achieving a normal or just elevated blood pressure. I think what's really impressive about this over time is members are actually going to work through this continuum as they change lifestyle and behavior patterns along the way. So it's not that you move from stage 2 to normal in 6 months. You really need to work and change patterns, and that's what Hello Heart helps our members to do by feeding them small bits of content and actionable results. Next slide, please. On this slide, we're focusing on members within each year of our program that have received a reading defined as a hypertensive crisis. And you may think we shouldn't we really want to celebrate these, but I think what's important is Hello Heart A has captured all of these, and these represent members that have had that crisis and returned to a controlled range with their blood pressure. When you think about a hypertensive crisis or a blood pressure of 180 over 120 or above, this provides a very increased risk of very serious consequences like stroke or pulmonary edema, etc. Avoiding these events obviously can have an impact for Northwestern Mutual in our ability to control costs, but I think really more importantly, it helps our members avoid these severe issues and just have a higher quality of life, and have a little bit more peace of mind as they work through the process. Next slide, please. This last slide is a breakdown of our new users in 2020. And you can see that we had 704 new enrollments. And this is largely due to a couple of factors, but I will say, very attributable to Hello Heart's ability to help us integrate with current partners that we have. So in 2020, we did launch a new wellness program. Hello Heart is completely integrated into that program. So members are actually served up Hello Heart as an option based on their biometric data, and they can earn points towards their wellness incentive for logging their blood pressure and engaging with Hello Heart. Also, Hello Heart's created a very deep and meaningful integration with our mutual health centers. So we have 2 on-site primary care clinics where Hello Heart has trained our physicians and clinical staff on their product and platform so that our physicians can qualify members in real time during their physical or during a lab visit or whatever brings them into the health center. So Hello Heart has provided our clinicians with blood pressure cuffs so that they can take that cuff, have the member download the app, show them how it works, and really encourage them in real time and use the data that's sent back to them to work with the member to further the improvement of their health. So thank you so much for your time today, and I will turn things back to Julie.
Thank you so much, Janet. Wow, I am so impressed with the results that you were able to have with Northwestern Mutual partnering with Hello Heart. As a heart disease survivor myself, I know how important it is that we take care of our hearts and make sure that they're able to take care of us. So I'm so inspired to see all the great work that you've been able to do together. And so I'm excited to share a little bit with you about Accenture's Outcomes and what we've been able to do with Newtopia. So as I mentioned in the beginning, we've always had a holistic approach to well-being that's gone on for many, many years. Recently, we focused on driving into data-focused solutions to help our people and bridge that gap and help those who may not have always sought after those well-being solutions or participated in, but really felt that they belonged and got inspired and had something that made sense and felt authentic for them. And so what's really interesting is though, as we look at some of our data, we are absolutely blown away by what was able to be accomplished during a pandemic. If you think of the general population, many people will tell you during this time they became less healthy. They became less focused on their daily patterns of taking care of themselves, that self-care element. Many people gained weight, stopped exercising or decreased their exercise because they were staying at home. Even just that daily lifestyle movement stopped. Their focus on nutrition changed. Maybe they were stressed and they ended up, eating stress-based foods. They ended up not sleeping as well due to anxiety. That sleep leads to other things. People felt a sense of lack of accomplishment, lack of achievement. These are all these things that started to go on with just the population as a whole, not at Accenture, but just as our population. But here at Accenture, in our partnership with Newtopia, our participants actually found a different story. You see 69% of those who started remained engaged for 12 months. I think that is such a significant data point because You know, you see wellness programs that can come and go and it gets somebody excited and maybe they earn their $100 or whatever it is and then they drop off. But Newtopia kept nearly 70% of our people engaged for 12 months. And you know, the secret to the success of any habit-based program that's trying to get people to establish new patterns in their brain and in their bodies is that they're just consistent with it. And so to say that 69% were able to stay consistent is pretty significant. So as you look at these data points here, 3.7% of our total population lost weight, but 6.3% is the average weight. I'm sorry, 3.7% is the average weight of our total population, but 6.3% is the average weight loss for participants who lost weight. Now, one of my favorite data points of this whole section here is that 73% is the average percentage of participants losing weight. So that means that almost 3/4 of those who participated in the program had some results. And one of the things that we have found when we implement any form of culture shift program, well-being program, anything that asks employees to change a pattern or what they're doing, they have to see the value in it. They have to see the benefit. They have to feel good about it. And 73% of our people were able to reach that. Those numbers, I don't know that you'll find too many programs that would give you 73% of those who participated had that kind of outcome. It's extraordinary. And we're really proud of our employees. And we're really proud of that partnership. So if you want to go on to the next slide, please. So a few more of these statistics, and one of the things I like to do is tell the story behind the slide. I don't always read all the data points, but feel free to take a look at the data points. What this slide will tell you is that by and large, Accenture's employees really found this program and this partnership to be something that spoke our language. In almost every category that was measured, we exceeded Newtopia's book of business in terms of what the expectations were. And I think it's because Accenture was looking for something that was seamless, holistic, personal, all the things I mentioned before, and had all those different layers. Because one day when somebody's having a bad day and they don't feel inspired anymore, they've got their inspirer. On another day where they're really just looking for a real person to tell them that it's hard, and they go out to the place where they can connect as a community and hear from someone else's story. And then they get their data driven through some of their wearables and so forth. It really made it for this really great connection. Our people are smart, they move fast, they're diverse in their interests and their understandings. They really need something that will go with them and meet them where they are, how they are, and what they want at that time. So if you take a look at this, from our average weight loss, we can see that those who were continuously engaged, of course, lost a little bit more than those who weren't. We also know that those who were continuously engaged achieved greater than 5% of their weight loss more often than those who weren't always continuously engaged for those 12 months. And then this is my favorite data point. This to me, when I look at the research and when I look at what this truly means in science, this is the cool thing for me. 25% of those who were continuously engaged moved their BMI class. Now, there's a lot of data points that'll tell you exactly what that dollar amount is for savings for them or what that means in terms of longevity. And I won't argue exactly what those numbers are, but what I can tell you is that we do know this. By those individuals moving their BMI from obese to overweight, they just took their life back. Like they just changed their life. They're going to live a longer life now. They're going to live a greater quality of life now. And they're going to save some of their money and maybe some of Accenture's money too. But you know, the main point is that the main focus here is that we just helped them. We provided them a tool, but they did the work. They did the tough work, but they had a partner that helped them to do that. But it's really extraordinary when somebody can take their life back and realize that they're going to live a longer, healthier, happier life where they can go do more and they can go take vacations and enjoy them and play with their children and play with their grandchildren and live their life on their terms. And that's really what we hope for our employees. So we're really grateful for this partnership and for the impact it's had for our employees. And we look forward to perhaps a year after pandemic where hopefully people are even more motivated to get out there and do more and not take so much for granted as maybe we have in the past, and maybe have even new, more amazing data to share with you this time next year. And so Shiloh, I'll turn it back over to you so we can take some questions and answers.
Thank you so much, Julie. And again, to Janet for your excellent presentations and, walking us through your journey with each solution. I do have a few questions I wanted to ask while we still have a few minutes left. The first, and I'll have Janet, if you don't mind answering this first, and then Julie. What do you think is most important in a solution that supports remote visits in this new era of care? Is it best-in-class outcomes? Is it being doctor agnostic or integrated to your vendor ecosystem? Any combination thereof?
Yeah, I think it's a great question. I think all of those things are important, but for us at Northwestern Mutual, one of the things we've learned during the pandemic is that um, convenience for our members and trying to lighten the burden of what they have to do is really important. So in my mind, I think two things. One, integration with all partners and making things as seamless and easy as possible. And then secondly, um, flexibility to meet members where they're at, and whether that's from a time commitment or technology, and utilizing new technology and platforms like text and video and email, I think are all really important for us as we think about these types of solutions.
Yes, Janet, I couldn't really have said that any better. And I thought, wow, what am I going to say? Because that's exactly what I was thinking about. But what I will say is, you know, like you said, it's the convenience. It's saving people time. It's making it easier. It's, you know, as you go out to an organization's portal, people can be overwhelmed, and they typically don't look for their benefits information until they need it. And then they're overwhelmed and frustrated. I think that as we move forward, it needs to be simple. It needs to be something that even if it's highly orchestrated behind the scenes and complex, our employees feel as if they found it very simply, easily, and they knew where to go and what to do as soon as they needed it. I also think that as we go into these virtual platforms, encouraging our medical practitioners as well as any of the technology to be seamless in terms of providing quick analytical answers. So if you get blood work done, you get your results back, you have someone there who can coach you and help you to understand it. We also can make it rewarding and educating so that you just don't get results and feel like you're in a silo of not understanding or what do I do now, but that you have people there who are ready to help you and coach you and set a plan with you. And these are all very integral parts of a really strong well-being and medical plan that if we can get this right, we can really make it easy for people to be healthy.
Thank you. Makes a lot of sense. And especially as we continue to think through what this world will look like with the explosion of virtual solutions, wearables, remote monitoring, et cetera. The last question I have, and I'll go to you first, Julie, is one, just looking ahead. Do you think remote monitoring is going to be used by employees with their providers in the long term going forward? And also, what do you think that might look like for Accenture and how they approach, you know, your benefit strategy going forward, and likewise for Northwest Mutual?
Absolutely. I think that it's here to stay. I do think that there is nothing that can replace face-to-face, especially when it comes into delivering very difficult messaging. If somebody is really dealing with a difficult illness or disease, obviously being in person and having that compassion is something that I don't think can ever be replaced with technology. However, I do think that making it simple, instead of having somebody to take half a day off to go in for a regular checkup, if we can find ways to fine tune this and make it more simpler, and when somebody has a cold that they can just call into a virtual session, I think that these types of sophistications can help people to get more time back in their day, get the care they need, not avoid the care that they need. Oftentimes, especially with mental health, people don't want to be seen leaving their offices, although I'm hoping that stigma is changing a little bit. They don't want to take the time out. Now that we have some of these virtual platforms, there's less excuses why people aren't going to get the help that they need, and then make it pretty much easy for them to, make healthy choices. I always like to say, if in 5 minutes you would be healthier, happier, you would live a better life, you would sleep better, you would feel better, you'd be more joyful, you'd be more productive, and you'd have greater performance, would you do it? And of course, everybody says yes, but oftentimes it's that 5-minute phone call that you make to your doctor or to your counselor, someone that we just don't do because we run out of time in our day and we compromise on ourselves. So if we have the opportunity to do more virtual things that saves time and gives high quality care, then we are definitely all in. But again, always just reminding that sometimes there is really nothing that can replace that human to human interaction that sometimes we just need.
Thanks, Julie. Janet?
Yeah, thanks, Julie. I really agree with you. I do think that remote monitoring and remote visits are here to stay. I also agree. It doesn't take the place of face-to-face, but what, maybe it does do for our members and what we've seen is it's actually helping to create a deeper relationship, especially at the primary care level, where the physician can actually reach out more periodically for shorter questions, for quick snippets of information to follow up on things. And I think participants like that, and more frequent engagement really does help them to manage kind of the totality of their care and their health in a better way. So I do think it's here to stay.
Well, I think that's the last word. And I just want to say thank you so much, Janet, and thank you so much, Julie, for your time today and for your presentations. And of course, thank you to Hello Heart and Newtopia for sponsoring this session. This does conclude our breakout. And thank you again for all of you for attending this. Have a great rest of your conference experience. Bye.